Hello again, this is Jeremy Arney talking to you from Victoria, British Columbia. This particular moment I want to talk to you about something that's very close to me, and that is health. I've noticed in this election that's going on right now, the talk about health is fairly generic. By which I mean each party is saying, oh yes, they're going to give 6% per year to the provinces ad infinitum, or at least till 2014. Well, this is fine and dandy, but the fact of the matter is that I don't believe that any party is really looking at what's happening in the health field. Yes, the federal parties are only really responsible for money being donated to the provinces because health is a provincial matter. But let's look at this another way. At the moment, health is really to do with drugs, with vaccinations, with injections, with hospitals, with Western doctors, nurses, all of whom are trying, well, not all of whom, but most of whom are definitely trying to help you. However, there is something else that's going on behind all this which I really don't like. Bearing in mind that health is a provincial responsibility, why is it that a federal body called Health Canada is trying so very hard to take away the basis upon which a vast majority of us wish to retain our health, wish to use natural health foods, natural health products, to boost our immune systems, to keep us healthy, to stop us from getting sick, to stop us being a drain on the provincial health schemes. It seems to me that anything that happens to keep us from being a drain on the health system would be beneficial. But no, Health Canada, largely I think because they're greatly sponsored by the pharmaceutical companies, we can argue about that another time, but just accept what I'm saying for the sake of it, please, are pushing things like Gardasil, totally unproven for what it's supposed to be, a cervical cancer drug for young women. They're pushing it to girls at the age of 10, and nobody's taken it for 25 years, so they have no idea if it's going to work or not. Totally unproven, and yet Health Canada says, go for it, it's a good idea. But if you want to eat parsley, for instance, because somebody said it's good for you, no. That has to have a drug identification number. Something's wrong here. Something is desperately wrong. For thousands of years, natural health products have been used safely, effectively, without harm, without deaths. I would challenge you to come up with a death anywhere in Canada in the last, let's say, 50 years that can be directly attributed to a natural health product. I don't think you can do it. In the United States, on an average, 250,000 people die each year in hospitals due to the wrong drugs being given to them. And this doesn't make sense. It really doesn't make sense. If those people were allowed to take natural health products, maybe they wouldn't be in the hospital to get the crossing drugs. Does it make sense to you? So why is there not talk amongst the candidates? Are you ready to ask your candidate? Are they willing to stand up and say to Health Canada, get your mitts off natural health products? Because it's not your jurisdiction, it's provincial jurisdiction. What are you doing in that direction? Thank you.